TCAR.com.
All right, thanks, Ashley. Each year, more than 500,000 Americans suffer from strokes. So today we're talking about a special device that offers a treatment and a faster recovery. Joining us now is Dr. Edward Gifford from Hartford Healthcare's Backus Hospital. Doctor, welcome.
Thanks. Good afternoon.
So we're talking about something with the acronym TCAR. Can you pronounce it for us and tell us what it is?
Sure. So we call this TCAR, and what that stands for is transcarotid arterial revascularization. So this is a novel stent that we've been offering patients within the Hartford region for the last 3 years. We've done about 100 cases there. And starting in July this year, we've been the first hospital in eastern Connecticut at Backus to offer this procedure to our patients locally.
So why would a patient get TCAR?
That's a great question. So we usually do TCAR or some type of stenting procedure in order to alleviate the blockage of one's carotid artery. That's one of the arteries that goes up to your brain. We want to alleviate that blockage because in up to 25% of strokes, that's the main culprit. Sometimes when that's either causing a stroke or it's causing a severe narrowing, we clean that artery out in order to prevent a future stroke. That can either be done via an open surgery, which is the traditional way to do it, or a less invasive approach, which is the stent approach. TCAR allows us to combine the best factors of both of these two technologies.
So let's talk about TCAR in comparison to other treatments. Is it better?
It depends on who you ask, I guess, but in my opinion, in certain ways, it's absolutely better. So the gold standard really is the open surgery. In fact, that actually has the lowest risk of a stroke afterwards. This is what we as surgeons care most about for our patients, and certainly our stroke patients care about. However, it's not without its own set of risks. So it does have a higher risk of bleeding afterwards and a higher risk of either temporary or permanent nerve injury. The minimally invasive stent approach is nice, but unfortunately, although it's less invasive, it actually has a higher risk of stroke than that traditional open surgery. Again, TCAR allows us to do the minimally invasive stent, which helps our patients recover faster, but it actually has the same low stroke risk as traditional open surgery.
All right. Can anyone who needs a carotid procedure get TCAR?
Other good questions. So TCAR is currently approved for high-risk patients. High risk depends on both the patient's anatomy, so certain factors of the blockage in their neck, as well as some of their other health-related risk factors such as age, diabetes, factors such as that. Those are the types of things that we discuss with patients and their families when they come in for a consultation and try to offer them what we think is the really best option for both their health and their disease.
All right, and let's talk about strokes in general. What are some of the symptoms of a stroke, and what is the time frame to get help?
So timing in terms of stroke therapy is key, right? We always say time is brain, and that really is true. Some of the things that we tell patients to look out for are vision changes. So, for instance, a classic vision change is a shade falling across an eye, or unilateral numbness and weakness in an arm or a leg. Sometimes the symptoms of a stroke or a TIA, which we call a mini stroke, can be changes in speech, so like slurred speech or garbled speech. All of these are time-sensitive issues. These are not the types of things that even if they go away, we want patients to fall asleep on. We want them to get into the emergency room promptly so we can evaluate them. That time-to-brain window is necessary, especially in cases of a major stroke where we want to get them in the door quickly.
And what is that time? Is it just a few hours?
It's just a few hours. So realistically, if we can get them in the door less than 3 hours from the onset of their symptoms, that gives us the biggest window to be able to treat them.
All right. Dr. Edward Gifford, thank you so much for joining us and telling us about TCAR.
Thanks so much for having me.